Hi, my name is Josh Wallen, and I chose to do a blood pressure screening, and we did that at a local church where there is mostly an older population since they are more at risk for getting high blood pressure. So, for the procedure, we want to start out by introducing ourselves to the patient, and we just want them to know who they are or who we are, and we want to know who they are so that they feel comfortable around us. Then we want to explain the procedure process. This is meant for comfort, so that they know what to expect and they're not startled by anything and not expecting something. We want to make sure that we assess the patient's current status. So make sure that they're healthy, that they're okay to be doing the exam right now, and make sure that there isn't any underlying issues that we need to address. We also want to take a look at their arms and just make sure that they have good blood flow and that it's safe to go ahead and use a blood pressure cuff. Then we want to take the radial pulse exam so that we know what the heartbeat is at. And after that, we want to follow up the two-step blood pressure exam, and that's just done by putting our fingers on the radial pulse, or I should say the radial artery, and then we put the sphygmomanometer on, and we on their arm, and we want to make sure that the correct part is over the brachial artery, and then we want to go ahead and pump it up until we don't feel the radial pulse anymore. And once that's gone, we take a look at that number and we add 30 to it. We deflate the cuff, and then we go ahead and pump it up to the number that's 30 above the number that took the pulse away. Then we go ahead and read their systolic and diastolic measures. And we want to go ahead and educate the patient, and we want to help gear them toward health promotion. The tools that we used was a sphygmomanometer, which is a blood pressure cuff, the stethoscope, and we needed a watch with a second hand for the radial pulse assessment. And then we also have alcohol wipes so that we make sure that the instruments are clean between each patient. The resources I used for blood pressure measurements were from the American Heart Association. For nursing interventions, I used Unbound Medicine, Nursing Central. For the nursing process and professionality, we used the American Nurses Association to help guide us toward professionalism. And we also used the textbook, Nursing: A Concept-Based Approach to Learning. This is a chart from the American Heart Association about normal through hypertensive crisis blood pressure levels. So when we take the blood pressures, these are the criteria that we are looking at and that we're going to help with their interventions with. So to break it down, if the patient's normal, and really normal through the high blood pressure, hypertension stage 2 are pretty much going to be the same thing, we still want to teach health promotion. So even if they're normal, we want to make sure that they understand proper nutrition, the importance of it, the importance of exercise, the effects that high blood pressure can have on the body. And we also want to interview the patient about their lifestyle, about their comorbidities, make sure that there isn't any underlying diseases that can cause high blood pressure. And we want to talk about any treatments that they're currently participating in. And then we also want to do the same thing for the other three stages, the next three stages. But if we find ourselves in a hypertensive crisis, we need to make sure that we assess that patient right away and make sure that they're safe. So we want to make sure that they are taken care of, that they're comfortable, and that they're not in a life-threatening situation. And once we have done that, we're going to go ahead and direct them to their healthcare provider immediately because they need to get treatment right away. So I added this slide from the American Heart Association. This is risk factors associated with high blood pressure. These are, patients with high blood pressure are at risk for stroke and for heart failure, for sexual dysfunction, for vision loss, heart attack, and kidney disease and or failure. So this is something that we would definitely want to educate our patients about. Risk factors for high blood pressure, a modifiable one that can be changed, is a poor diet. A non-modifiable one, which means they can't change, would be the patient's age. And I got these from the American Heart Association. So what would we do if we found someone? So we have people that are older, so they're already at risk. So we want to make sure that they're in the best physical condition possible. So an intervention for this would be that the nurse will educate the patient on the importance to maintain an active lifestyle to reduce the risk for high blood pressure. For the poor diet, the nurse will educate the patient how to eat a healthy balance of food with each meal that is low in sodium, and that will help reduce the risk for high blood pressure. So again, diet has a big role in this. We want to make sure that the patient knows how to eat healthy. We want to provide them resources if they need resources, and any kind of teaching in case they don't know how to do so. So, as I said earlier, our targeted population was mostly older adults. We had a few people that weren't old, but for the most part, there was somewhat of a diverse population, mostly whites, but we had some African Americans and a few of other ethnicities. And what's really interesting to note is that African Americans actually are at higher risk for getting high blood pressure than other races. So I realize this is a common risk for older adults, but I chose a risk for falls because it can impair the ability to stay active, which is one of the interventions that we have to help people not get high blood pressure. Or at least people that have, or even people that do have high blood pressure, to help them to regulate it. Physical activity is very important, and so the risk for falls for this population, I felt like was a good rationale. Interventions that we would do is the nurse will provide a fall risk to help see where the level of risk is at for falling. The nurse will also educate the patient on how to be more aware of their environment to prevent falls. So make sure that their environment is free of clutter, they don't have loose rugs, stairs without railings, and just things like that that could promote falls. So biases are a big problem in healthcare, and a bias is the favoring of a group or individual or over another, which I found in nursing a concept-based approach to learning. Um, personal biases that I have regarding toward the older population when I was reflecting is that they're set in their ways, can be set in their ways and stubborn. They're near the end of their life, so it's a little harder to want to treat them because they're just getting ready to die, and that's really not what we want to look at when we do that. And then we have to slow down, and it's hard to be patient. And so, all of those biases in mind, we need to overcome those things because research concludes that when biases are present against the patient, they receive worse health care than others who do not conform to the provider's bias. And that bias has played a major role. That's scary. So to maintain professionalism in our clinic, the nurse's professional role would be to adhere to the American Nurses Association Code of Conduct. That really pretty much sums up everything about ethical nursing. We want to make sure that we assess the patient and we gear them towards health promotion, and that we educate the patient based on the findings and questions. Now, the nursing scope of practice, a nurse is morally obligated to advocate for the patient in and outside of work. It is of utmost importance to maintain patient safety, and that we must report illegal or immoral activities from other professionals. A nurse may step out of bounds in the following ways: by violating the ANA code, by alcohol or drug abuse, or allowing emotional overload to take over, or any impairment that adversely affects job performance. So, systems in place to help promote healthcare regulation. We have the American Heart Association. They set standards and parameters that are acceptable regarding cardiovascular care and for healthcare workers to use for practice. And then, as I stated before, we have the American Nurses Association, and they support nurses and organizations to advance the nursing profession to a higher standard. Thank you.